keratin dead skin layer. And sometimes you'll see people who have a whole bunch of them, and it just looks like they have red blotches. But unlike red blotches, which is blood vessel on the, let's say on the face, these you'll feel, and they're very rough. And people say, well, I just picked those off, but they don't go away. They fill back up as red spots. They are precancerous, and they need to be destroyed by freezing them or giving you a chemotherapy type cream. Next one, please. So those are actinic keratosis. They're scaly red bumps on sun-exposed skin. They are early skin cancers, but we can freeze them off real quickly and easily. And if people have a lot of those, usually it's the people who are outside a lot. If you're fishing or you play tennis a lot or whatever you do outside, it's an increased risk of having those and the skin cancer that comes from them. So common treatments are just to come in and we freeze them. Or I give you a cream to take home and you put it on 2 times a day until they get red and sore and they come off. Next one, please. But it's very important to notice that if you have them, you get them treated. So the best way to avoid all this nonsense, this red lumps and the pink bumps and the dark spots, is to protect yourself. And especially with the kids that we have, if we have kids, tell them to start early, because the earlier the better. And wearing a t-shirt, sometimes you'll see people who have medical issues or are on medications, they wear a t-shirt in the pool or something, but it really does not protect you. Okay, next one please. Yes, that's a myth. You cannot use a t-shirt. If you get it wet, it has an SPF of 3, and you need at least an active 15, which means you just put that on thick, and ideally 30 or higher. So if you wear a t-shirt, you're only going to get a 3 or 4 out of that, and that's not enough to prevent skin cancer. And then also the other thing is you need to put on the sunscreen frequently. You can go to the next one. It's a myth that you can put it on once and just go out all day. You need to reapply sunscreen if you get wet in a pool, if you sweat, or let's just say you've had it on for more than 2 hours while being out in the sun. So what you should do, you go to the next one, is when you're going to be outside, you should put it on 20 minutes before you go outside. Just get the highest number. They're all the same price now. And the reason I say to get the highest number is when people got an SPF 15 and they tested the average man, there's a man putting it on, like me, just kind of put it on like this, they got a 2 out of it because you don't put it on enough. Okay? So you have to take everything, let's say, divided by 7. So you might as well get 100. It's the same price, right? You might get a 13 or 14 out of it. So you also need it on days like this, a thin coating. You don't have to put a lot, but you can get a Vino, Jergens, whatever you want with SPF 15, and you'll be protected. It's much healthier going forward. And it saves you the liver spots and wrinkles and all that stuff. Next one, please. So we like to tell people to get the 30 at least if you put it on thick enough. But I'm telling you, when they test sunscreens for the SPF, they put a big, thick amount on that most people do not put on. So that's why I tell people just get the highest one, and if it's a little diluted because you didn't put on enough, you'll still get the equivalent of whatever, 15, okay? Next one, please. So 1 ounce, about the size of a golf ball, goes over the whole body if you need that. Maybe like a teaspoon for the face, and 20 minutes before you go outside so it has a chance to bind the skin and to be protected. Next one, please. And then I would just get in the habit of reapplying every 1 to 2 hours, and if you get wet in the water or you're sweating, put it on again. And they do make sunscreens for the lips, like chapstick with SPF. And don't forget, because it's a very hard operation sometimes, if you get sunscreen on the ear, and a lot of them are on the ear and the back of the ear, because we'll put it on all over, but you won't sometimes take the time to put it back here, but it gets sun all the time. The other place for that is the back of the neck. Okay, we just don't do it for some reason. So some people say, well, I better go into that tanning booth or go outside to get that base tan because I'm going on the cruise or going to Florida. It doesn't work. Any tan is destruction, or it's alteration of the DNA, not destruction, which could lead to a skin cancer. Okay, so you don't want to worry about base tans or the other things like t-shirts and things to protect. Next, please. The one thing I'll tell you is if you go to Sports Authority or Dick's Sporting Goods, they make ultraviolet protection factor weaves in their clothing. You can probably get them anywhere now, wherever you would get your clothing, and it'll say UPF 50. That means it's got the equivalent of a sunscreen with an SPF of 50. And it's in the weave and the type of material. But I would make sure you get that if you want to protect yourself from clothing. So that is, those are the main types of skin cancers, and also I showed you warts. So do you remember these things? You're all going to see them on your friends or yourself. Are these cancer? No, these are not. So you don't have to worry about that. Next one. And what is this one?
Squamous cell.
Squamous cell. Basal cell doesn't have that thick coating on it, but whoever said basal cell, you wouldn't be incorrect. It does look a little pink and shiny, as long as you know it's not supposed to be there and you should get it checked out. But that is squamous cell. That's good. So these things, very dangerous?
No.
Right, you don't have to worry about those. They're liver spots because of the color, but it's really just from the sun blotches that is just really discoloration, not even growth. Next one, please. So again, what do? Your doctor said this mole is normal, but it begins to change shape and size or color. He told you it was normal, so you just forget about it. Right, you just get it checked out, just like anything, right? And next one. So a pink spot on the face. This lady thought, I forgot what she thought it was, but it kept spreading, and it's pink and shiny, and it's ulcerating. So what do you do next? Yeah, you get it checked out. And the right thing to do is to get a biopsy. That's how you tell. It's a skin biopsy. Next one, please. And I'll tell you that a skin biopsy is never anything to be worried about. It is very easy. It's just like giving blood, unless you're afraid of giving blood. It's not a big deal. But all it is a quick shot of lidocaine and literally a little scraping to send a little piece to the lab. Okay? So any questions about all that? Yeah.
As far as not being able to get through sunball, how much, say, vitamin D3 should you be taking as a supplement?
You know, if you're deficient, there are doses for that. So some people go on 50,000 a week, some people go on 2 or 2,000 a day. You know, son, I go on the voyage, but I was low, I think, when my doctor checked, and he put me on 2,000 a day. I don't think it's really well known what it really means, the number, if you're deficient or not. And then, so they're trying to figure out what it means if you have healthy bones and you're otherwise healthy, how much do you need to take? I would say at least 1,000, and if you're deficient, then 2,000. And if you're still deficient, very low. Because I think it's important to have normal, healthy vitamin D levels. Then you get the prescription.
Is it like a catalyst for all the other vitamins?
It's not necessarily a catalyst for all the others, but it's important in protecting, well, some people think colon cancer, painful syndromes, fighting infections. It seems to be involved in many different forms of your health, so I think that it's important to have high levels, normal levels rather. And if you're avoiding sun, and you go into your doctor, that's a really good point, I'm glad you asked that. Vitamin D level, no matter what your skin pigment is, has to be checked. Okay, because you have to have a good level, I think, for all different forms of health. Preventing infection, preventing cancer, and preventing the kind of creaky aches and pains that creep in as we get older. Yeah. Yeah.
You mentioned, looked like you're using a cream sunscreen.
Right.
Do you recommend that versus the spray that's easier to get them
because
back?
if you watch them put it on their kids, and 90% of it is all in the air. It's all over the place, and you can't get a big enough coating. And it's really a waste because so much of it doesn't get on the person. If you have a cream, it gets right on you. You can't get anywhere else. Those sprays, I think they're really a boon for the people that make it because most of it doesn't get on you. And I don't think it's protective enough for you to get the thick coating that they test you for. So it's really protective, so if there's one area you're going to focus on, like your feet or something like that, it's fine. You can spray it right down onto that. But to get yourself, your whole body, and it's really tough. I don't recommend it.
The other thing is, what if you tan in a can?
That's fine.
There's nothing in there that can harm you?
As far as we know, when you watch the news, it seems like every time you hear something, it causes cancer or something. But as far as we know, it doesn't. And I just want you to know that if you do use the Jergens or the other spray-on tans, they're not protective. So you can't use that as protection to get against burning. You have to use sunscreen also. Yes?
What about little bumps on your face that are like they're teeny tiny and they're like fatty tissues, and you get more of them as you get older.
Well, you're describing a lot of different types of growths that we get as we get older, and I would tell you that most of the time those things that just kind of proliferate and come up and stay the same size
Right.
are fine.
Do you get them removed?
I don't really tell people to get anything removed if it's benign. The only reason I tell people to get something removed if it's benign is if they say it's really irritating or it rubs or something like that.
How do you prevent it from getting more?
You can't. They're all natural. So there's no way to prevent any natural growth from coming.
Okay. Thank you.
You're welcome. Any other questions? Yeah.
You were talking about white t-shirts when you're
Right.
out on the beach or at the pool or something. If you wear a colored t-shirt, does it protect it even more? Or
Yes, there was something that just came out, it might be on that slide too, I don't remember if it said the difference between the colors, but you get a little bit more, but it's not above 10, I think it went from a 4 to 7 or something like that.
since I have very fair skin, and so if I'm at the beach for more than a couple hours or
Yeah.
something like that, I'll put sunscreen on and then a t-shirt
Right.
if I'm not in the
Yeah,
water.
it's important, and there's companies, if you go on the internet and you just type in sunscreen clothing or sun protective clothing, there's really good brands that make things you could run a marathon in the desert. People literally do that, that's how they don't burn. And it's cool, you can stay out all day in actually the Arizona heat that's made for that. And they go all the way down to your wrist, they go all the way down to your legs. That's what a lot of people who are dermatologists put their kids in for their early years to go to the beach, and the hats are the same material. And the weave is like 100 SPF, and it's so light that you could be out all day, but then you have to protect where you don't have it.
My dad needed that.
Yeah,
He's out
but-
in the sun all the time.
Right, so that's important. There's brands named Cool Bar, Soul Bar, and some others that you'll find on the internet that are very good.
Thank you for letting me know about that clothing.
Oh yeah, you bet.
Because I was on a lot of blood thinners, every time I moved, I seemed like I got bruised.
Yeah.
These things have been there for 6 months, and really haven't changed.
The purple spots?
Yeah.
Yeah.
Is that anything to be concerned about?
Well, when you're on blood thinners like aspirin or Coumadin or Plavix or any of those, you know, I can come up and just go like this and nothing happens. You know, I'll hit my leg, you'll just kind of come up like this. But when you get home, if you're on blood thinners, you'll see those purple marks. That's blood under the skin, and it could be there for quite some time. And also, there's certain vessels that are so superficial on the forearm that they just get hit over and over again. And as long as they're just purple, flat, look like blood, and they should eventually fade out because blood has to be degenerated. It goes through degenerating phases of different colors also, like a typical bruise. You're fine. If you have a purple spot that just keeps getting thicker and again, bigger, there is a form of skin cancer of everything in the body, and there is one of blood vessels. So I would just say, if somebody's watching a purple spot in an odd location like the face or the scalp, that could be something serious. But more times than not, 99% of the time, when it's the hand and forearm purple spots, it's from your blood thinner. So it usually is not something to worry about.
Is it true that if you nick yourself in the same place, and you shave all the time, it will cause cancer? My father told me that. I don't know if it's true.
It's not true. But it comes from a possibility that if you have a chronic ulcer, so anybody who has leg ulcers or something like that, you can develop skin cancer in chronic ulcers. But the nicking, that type of thing, just getting scratches or scrapes, it's not going to harm you in any way. Yes?
Does UV radiation go through the water?
You know, the glass panes that we have in our windows and water of a certain depth blocks ultraviolet B. But ultraviolet A can penetrate for a distance through glass and through the equivalent amount of water. So, you know how it gets darker and darker as you get deeper and deeper, and it also depends how murky that water is. If it's murky, you're going to be pretty much clear after the first couple inches from ultraviolet. That's usually not the problem when you get out. It's your head and neck, because you have a worse problem from the reflection. So usually when you're in the water, it's not going to penetrate so deep that you get burnt down on your legs or even your abdomen. But where you have sun exposure and the water's reflecting, you will have a greater burn than you would just without the water reflecting. Same's true with snow.
Skin skin cancer more prevalent now than it was?
Yeah, the numbers are going up and up and up. And we don't know if the numbers for skin cancer are going up because we diagnose it more, people are more aware of it, but it's probably because people are tanning more and they're outside more. And despite the recommendations not to, you still will see billboards that says unlimited tanning 1999, and it's cheap and accessible, and the kids, still in my kids' high school, the tan looks better, and I guess our protective layers in the atmosphere are not as good at filtering out ultraviolet, so it's probably getting more intense. So I think it's really actually the incidence is increasing, and we're not just diagnosing it more. Anything else? Other questions? All right, well, have a good rest of your meal and your meeting.
Thank you.